Welcome, and thank you for joining us on this important journey into understanding the Human Metapneumovirus, also known as HMPV. You may not have heard much about it, but this respiratory virus has been quietly circulating for decades, affecting millions worldwide. In this video, we will uncover the mysteries of HMPV, what it is, how it spreads, the symptoms it causes, the precautions you can take, and the medical assistance available. Stay tuned, because this information could help you protect yourself and your loved ones. So, what exactly is HMPV? HMPV, or Human Metapneumovirus, is a respiratory virus that primarily affects the lungs and airways. Scientists first identified it in 2001, but research shows that it has been circulating in humans for over 50 years. It belongs to the Pneumoviridae family of viruses and is closely related to another well-known virus. Respiratory syncytial virus, HMPV, is a seasonal virus. It is most commonly seen in late winter and spring. It affects people of all age groups, but is particularly dangerous for young children, older adults, and individuals with weakened immune systems. Unlike more well-known viruses like the flu or COVID-19, HMPV doesn't have the same level of public awareness. That's why spreading information about its impact is crucial.
How HMPV spreads. Like many respiratory viruses, HMPV spreads through respiratory droplets. When an infected person coughs or sneezes, tiny droplets carrying the virus are released into the air. These droplets can be inhaled by others nearby, leading to infection. HMPV can also spread through direct contact with contaminated surfaces. For example, if you touch a doorknob or a shared object that has the virus on it, and then touch your face, you could contract the virus. Crowded spaces, such as schools, daycare centers, and hospitals, are particularly vulnerable to outbreaks. This makes it essential to understand how to limit the spread, especially during peak seasons.
Symptoms of HMPV. Now let's talk about the symptoms of HMPV. For most people, the symptoms can be mild and similar to those of a common cold. These include a runny nose, coughing, sneezing, fever, and sore throat. However, in some cases, particularly for infants, older adults, or people with underlying health conditions, HMPV can cause more severe symptoms. These may include shortness of breath, wheezing, chest pain, and fatigue. In severe cases, HMPV can lead to bronchitis or pneumonia, both of which may require hospitalization. Infants under the age of 1 and adults over 65 are particularly at risk. If symptoms worsen or you experience difficulty breathing, seek medical assistance immediately.
Diagnosis and medical assistance. If you or a loved one are experiencing symptoms that might be linked to HMPV, it's important to seek medical advice. Doctors typically diagnose HMPV through a combination of physical exams and laboratory tests. A PCR test or a nasal swab can confirm whether the virus is present in the body. Currently, there is no specific antiviral treatment for HMPV. Instead, treatment focuses on managing symptoms and preventing complications. This includes rest and hydration to support the immune system, over-the-counter medications to reduce fever and relieve pain, and, in severe cases, oxygen therapy or hospitalization may be required. For individuals with weakened immune systems, healthcare providers may take additional precautions to prevent secondary infections.
Precautions and prevention. While there is no vaccine for HMPV yet, there are effective ways to reduce your risk of infection. Here are some precautions you can take. 1. Wash your hands frequently with soap and water for at least 20 seconds, especially after being in public places. 2. Avoid close contact with anyone showing symptoms of a respiratory illness, such as coughing or sneezing. 3. Regularly disinfect commonly touched surfaces like doorknobs, light switches, and mobile phones. 4. Practice respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of tissues immediately. 5. Consider wearing a mask in crowded indoor spaces, particularly during the peak season for respiratory illnesses. For parents, Ensure children learn good hygiene habits early on. These simple steps can significantly reduce the risk of spreading HMPV and other respiratory viruses.
Final call to action. To wrap up, HMPV is a respiratory virus that can affect anyone, but it poses the greatest risk to infants, older adults, and those with weakened immune systems. While the virus may not always cause severe illness, understanding how it spreads and recognizing its symptoms can make a significant difference in how we manage it. Remember, prevention is always better than cure. By practicing good hygiene, being vigilant about symptoms, and seeking medical advice when needed, you can protect yourself and your loved ones. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more health-related content. Together, we can create a healthier, more informed community. Thank you for watching, and take care.